Welcome to Bariatric Makeovers. I'm Dr. Hanna, and today we'll be talking about the successes of weight loss surgery. And I'm talking today with Amber. We'll talk about her journey through weight loss. So, hello, Amber.
Hello, Dr. Hanna.
How are you today?
It's a pleasure to be here. I am doing fine. Couldn't be better.
Excellent. You look amazing.
Thank you.
You're welcome. So, tell me, how did this journey start? It's been about a year and a half since we met?
Yes.
So what brought you to Las Vegas Bariatric and me?
Many years of illness and trial and error and specialty doctors that could never figure it out. And the less I ate, the more I gained. The more I gained, the madder I got. And the madder I got, the more I blew up like a balloon. And I said to my primary care doctor at the time, which is a different doctor than I have now, I said, you know, we got to do something about this. I've had it. Well, there's nothing we can do. And I said, oh, yes, there is.
Gee.
I said, because I've been doing my research.
Great.
And here's what I'd like to do. I would like to see a bariatric surgeon. And I know just the one. And I said, could you give me a referral? Because I cannot do anything without a referral. So, did. And then I came to see you. And of course, it wasn't as easy as I thought, because I had to go through several tests. And I had a lot of problems, really, a lot of problems, more than the norm. Everything was wrong with me that could possibly be wrong.
So health issues.
Lots of health issues.
Like what? Tell us.
Okay. I had bladder problems. I had kidney problems. I had thyroid problems. I had a heart that palpitated and raced out of arrhythmia, and just would, at any little stressful event, my heart would almost go into arrhythmia.
Okay.
It was very hard for me to sit up, get down. I was very big for my my height, and it was very hard for me.
What was your mobility like?
Awful, just awful. I just didn't have much balance, and I was really down on myself. I never felt secure. And I'm a very positive person, and
That you are.
I try to be, and very secure, but at this time, I just felt the whole world was against me, and I had tried everything.
So you tried the weight loss regimes?
Oh, yes.
The diet, the exercise?
I did have a lap band
Sure.
for 7 years, and I have to tell you, with that lap band, really, it did more havoc with me than it did good. And digestion, I even had friends say to me, you don't even talk right, you know, you can't even talk right. There's something in your throat, in your esophagus, there's something going on. And then one day it broke. And when it broke, I thought I was having a heart attack. It broke 7 places. And this is not Dr. Hanna that did it, this is another surgeon. So I was a year trying to repair from that, and the weight that I had lost, which was very little, I had gained back in that year.
So you're back to square one.
I'm back to square one, mad as a wet hen.
Oh boy. Well, it's interesting that you say that, because now we're seeing a lot of patients who've had lap bands and gastric bands in the past. And a lot of them now are coming to us from all over, out of state and everywhere, who are not having great successes with their band. They're having issues, and we're having to actually remove these bands now. Now the bands are being phased out, so I'm glad you brought that up. So now that you went through all of that, your decision to proceed and have another surgery, that's a big decision.
I said, we're talking about my life here and my health.
Right.
And I'm not healthy, and nothing's working. And if I don't do anything else, I need to try this because this is my last straw. It really is.
So you persisted.
I persisted, and they gave in. And the insurance, they say no, and I call my insurance company. My insurance company would say, well, let me look at the files, let me look at your medical, and then we'll decide, yada, yada. Stalling. So anyway, after a year, and even when I first came in to see you, you said, let me look at your case history and let me see, and we'll put you through a few tests and we'll make sure that it's safe for you. And I'm not going to do it if I have any doubt in my mind.
Obviously, for us at Las Vegas Bariatrics, safety is key.
Mm-hmm. Yes.
First and foremost. So we have to make sure you're the right candidate for this. Mm-hmm. That's why I look at everything in detail mm-hmm. and make sure that you're a suitable candidate to undergo anesthesia. Yes. And that you were. So here you are, looking great.
And that's what they were afraid of. Yes. Really, that's what they were afraid of. I wasn't strong enough to do this again.
Right.
And to go through it. But in my mind, I knew I was, and I was going to do it. And if people believe in a higher power and a God above,
there you go.
That's all it takes. With a good doctor, you've got it made. You're home and running. There's only two: a good surgeon and believe in God.
Amen.
And without that.
So tell me, you had the surgery. How did you do that differently this time than when you had the gastric band? Obviously, lifestyle had to be in line.
Yes.
Your eating habits.
You have to psych yourself out and say, okay, I'm going to do this, but I need to turn it over to the professionals, and I need to pay attention if I want to be successful. It's like taking an exam or passing finals in college. You need to pay attention and do as you're told.
Yes, and commitment.
Commitment.
Right.
And being positive. You need to be positive about this. If you can't be positive and true, search your well-being and know that if you can't be true to yourself, why do this? Because it isn't just your surgeon, it's also you.
Of course.
And you have to eat as you're told, exercise as you're told, and drink your water. And that isn't hard to do, really.
So the surgery is a tool, right?
Surgery is a tool.
And you have to put all these other components together, like you say, a little exercise, eating properly, healthy meals.
And you got to remember that it's us that puts this food in our mouth. It's not the doctor.
Yeah. So it's all about choices.
Choices.
Life's choices.
Everything in life is the choice you make. What is the sense in going through it if you're not going to be successful? You're the only person you're fooling is yourself. And don't think for 1 minute that the doctor doesn't know what's going on.
Exactly.
I mean, really, it's like being a parent.
Yeah. So you have to be true to yourself.
True to yourself. You can't just go and say, well, Dr. Hanna, I'm doing everything you say, and then before you come in, you had a piece of pie or a cookie.
Exactly.
Hello.
Exactly.
Do you think
so it's all you?
It's all up to us.
So do you consider yourself success now?
Yes, I consider myself very successful. If I had to do all over again, I would have done it much sooner. If I could have, I would have. But things didn't play out that way.
Right.
But if you're there and you've tried it all, I really think you should try Dr. Hanna because he's got the best program.
Thank you.
And he's got the best nutritionist, and he's got the best people in the office, and it truly is a group of truly. This is no punchline. This is truly.
Well, thank you for that.
An extreme, wonderful doctor that knows his work. And, you have to love your work in order to be this good in anything you do.
You said it all right there. Because I love what I do. And I'm here for you. I'm here for my patients. And really, that's what Las Vegas Bariatrics is all about. We're here for you. We're your support system. And as I always say, you're my patient for life. So you have us always to count on, okay? So tell me about your health. How has your health improved since your surgery?
Do you want to know all the things that were wrong with me?
Let's hear it.
Oh, jeez. I've had bladder cancer, I've had melanoma, skin cancer all over my body. I just recently had nose surgery where
You're like a new person here, huh?
Yeah, well, I am the bionic woman. Now, I mean, this is just a couple of things. Then I had my thyroid removed, and you see my happy face here. And after that, I had my stomach removed. I had 7 surgeries before I ever made it to Dr. Hanna's table to have my stomach
Now,
removed.
how's your activity been now since all of this?
So,
Exercise,
exercise.
energy.
Energy is off the charts. I mean, the more you stay on it and the more you walk, just walk and meditate. You must, when I say meditate, people don't know how to meditate. Quiet your brain. Just find a place and don't think about anything. Quiet your brain because it'll take you away from that urge to want to eat.
It's all about being mindful,
Yes.
right?
Yes.
It's being mindful.
Being mindful.
Yeah.
Quiets your brain, brings you back around, and what is it you really want? What is it you're really searching?
And we use that terminology in eating also, you know, mindful eating.
Yes.
Because a lot of people have mindless eating. Like if you were sitting watching TV, which a lot of people do, and they start snacking, not really thinking about what they're doing while they're distracted. So at least for us, we try to teach our patients to be mindful, making good, healthy choices. When you're having your meal, focus on your meal. Be present.
Yes.
Know when you're satisfied.
Stop. You know, there's something that Dr. Hanna does to all of us when he puts us out, I think, that, and I think
What do I do?
It's that ghrelin hormone. You know,
Ghrelin.
that hunger hormone.
Yes.
There's something about that that mine says to me after a quarter of a cup, you know, you need to put that spoon or fork down.
That's right.
You've had enough.
You're satisfied.
You're satisfied. And here's a very important thing is don't say one more spoon, one more forkful. That's not necessary because one more could really be too much.
That's
and
very
then
true.
it wants to come up.
That's why we say slow down.
Slow down.
Take your time.
Yes.
Chew well.
Right.
Be mindful.
You're right.
Yeah. You mentioned ghrelin. Ghrelin is the hunger hormone that we can affect that when we do a gastric sleeve surgery. I remove a part of the stomach and I essentially remove some of the ghrelin also. So a lot of our gastric sleeve patients just have less hunger.
Less hunger it is. I mean, it's worked for me. It really has. And if it can work for me, it'll work for anybody out there having a weight problem. I mean, I was so overweight. Even my son said to me, he said, he came out here about 6 months ago and he said, here, would you be interested in this picture? And I said, well, what is it? And he handed it to me and I looked at it, I said, oh my gosh. He says, you know, Mom, I didn't realize you were that heavy. When you're around somebody and you see them go from small to heavy like you did, almost like overnight. He said, it doesn't, you know, you just don't realize that they put on all that weight. But even my kids say to me, you look great. You've never looked this good in so long. And
That's
you're not
amazing.
only great, but you're happy. And you see,
That's
you
key.
need to be happy.
Happiness.
Happy.
Yeah.
When you're happy,
You feel good.
You feel good. And when you feel good, when you smile, the world smiles with you.
Oh yes, they do.
And when you cry alone.
There you go.
So,
You know, you're a great example of
Yes.
the success story here. You know, you've done excellent. I'm so happy that you're doing great.
I may have been more successful, but I'm happy because
That's great.
I'm healthy. And, you know, if I never lose any more weight, I'm happy where I am because I feel good.
And that's it, you know.
Yeah.
Once you're content with your success, you're happy, you're doing great, your health is improved, you get around much easier. That's success.
That's success. It really is. You
Great.
feel so good when you go in the store and you can pass up size 24, size 22, size 20, 18, 16, 14, 12, 10. Oh, look at now, 8.
That's great.
Pretty
All right.
soon I'll say 7, 5, 4, 3. No. But
Beautiful.
anyway, I feel good.
Thank you, Amber.
It's a pleasure.
I appreciate you coming in today.
Thank you. Thank you
You're
so
welcome.
much.
My pleasure.